certain about the respiratory system. Come here and large. All of you are here. Where is your classmate? He went to turn on the lamp.
It's me, and I couldn't find the switch. Sorry.
Okay. About the respiratory system, in this moulage, you are going to look at to the hyoid bone, to the half of the cartilage. Which of the cartilage? The large thyroid cartilage. It is one of the fibroelastic membrane. What's the name of this? Thyrohyoid membrane. And here you have the foramen. What's the name of this artery? Superior laryngeal. What's the name of this nerve? Internal laryngeal nerve. And here is the oblique line, yes. And here is the Adam's apple or laryngeal prominence. And here is the inferior or lower horn, superior horn. The lower horn is going to make joint with the cricoid. What's the name of this muscle? Cricoid muscle. And here you have going to find the cartilage inside of the trachea. And if I rotate here, I am able to show you the aryepiglottic fold. Here is the vestibule. What's the name of this cartilage? Epiglottic. What's the name of this fold?
Vestibular fold.
And
Vocal
fold. Here is the vestibule, here is the middle chamber, and here is the infraglotte. Yes?
Yeah.
Now about the
Which nerve is this?
and here the nerve that is responsible to recurrent laryngeal. Most of the muscle, not all of them, most of the muscle are going to innervate by this nerve. What's the name of this nerve? Recurrent laryngeal nerve. And here you are going to look at to the pectoralis major, the breast is visible, the intercostal space, the muscle that is visible here is the stratus anterior, and here you are going to find the intercostal muscle, the costal margin, the xiphoid process, and here I'm able to show you the pectoralis major, pectoralis minor, and in this side, the transverse thoracis is visible, and here about the posterior wall of the thorax, you are going to look at to scapula, the spine of the scapula, supraspinatus, infraspinatus, the rhomboid major and minor are visible here. The major is inferiorly and the minor is superiorly.
Levator scapula.
Yes, and the levator is erector. This is levator scapula, but it is levator scapula.
Yeah.
But here is the erector spine muscle. And about the bone, give me some of this. No, about this I explained it is the same. Yes. And about the vertebral column, look at here. It belongs to the thoracic region. Body is anteriorly, superior articular process, inferior articular process, transverse process, spinous process, lamina, and here is the pedicle. What's the name of this foramen? Vertebral foramen, and here is going to form the intervertebral foramen. It belongs to the thoracic region. About the lumbar region, if you look at to this moulage, yes, the body is kidney shaped and the superior articular process is concave because of this process. The transverse process, yes, and it is the spinous process. It is quadrangle and it is going horizontally, okay? The form, the shape is different. About the cervical region, in the cervical region, at the root of the transverse process, you are able to find this foramen, okay? And the spinous process is bifurcated. Before you have two branches, yes. And about the sacrum, it is the dorsal surface, the anterior surface, In each side, you are able to find four pair of the foramen, the anterior sacral foramen and the posterior sacral foramen. In dorsal surface, the median sacral crest is visible. Here is the hiatus of the sacral. And here, medially to this foramen, you are able to find the intermediate or medial sacral crest. Laterally, you have the lateral sacral crest. Okay, median, medial, and lateral. Now, here is a superior articular process of the S1, and here is the promontorium of the sacrum, the ala of the sacrum. The coccyx is visible. The first vertebra of the coccyx is large, but the other are going to get smaller. Okay, and here is the sacrococcygeal joint.
You mentioned about the.
Here is the auricular surface. This auricular surface of the sacrum is going to articulate with the hippo. And here you are going to find the thyroid cartilage, the cricothyroid muscle. Here is the cricoid cartilage. The thyroid gland is visible, and here is the trachea. If you notice the internal jugular vein, the subclavian vein, make the brachiocephalic. Here is the right brachiocephalic, and here is the left brachiocephalic. Here you are going to look at to the thoracic aorta, the esophagus, and both of the lungs are visible. In the mediastinal surface or in the medial surface of the each of the lung, you are able to look at the pulmonary ligament and look at to the hilum. Inside of the hilum, the anterior and inferior structure are pulmonary vein. About the left hilum, the structure is less than the right hilum. Now, another thing here is the diaphragm. The central part is fibrous, and the peripheral part, you can find the muscle. And here you are going to look at the crux of the diaphragm. The right crux and the left crux. The aorta, after leaving the thorax, after passing through the diaphragm, enter to the abdomen, and the name change to the abdominal aorta. This foramen of the belong to the inferior vena cava. The inferior vena cava foramen in the diaphragm is the highest, and it is going to be found in the central part. So all of the peripheral part of this foramen is going to form by the fibrous structure. And about the heart, give me that heart. About the heart. Okay, go a little. It is the heart, consists of the right atrium, right ventricle, left atrium, left ventricle. Here you are going to look at the sulcus.
Coronary sulcus.
Yes, coronary sulcus, and in this surface you are going to look at the anterior interventricular sulcus, and here is the posterior interventricular sulcus. About the right atrium, here is the right auricle, and if I cut, you are going to find the anterior wall of the right atrium, the muscle. What's the name of this muscle? Tectonet muscle. In the right atrium, we are able to show you the opening of the superior vena cava without valve, the inferior opening of the vena cava with a valve, rudimentary valve. Here is the foramen that belong to the coronary sinus. Where is the coronary sinus? Between the left atrium and left ventricle in posteriorly inside of the sulcus coronary. This blue sac is going to remember you the coronary sinus. All of the blood veins that belong to the heart are going to drain into this coronary sinus. And here you are going to find the right atrioventricular foramen. Here is inside an inner layer of the right ventricle. The outflow, inflow, the outflow here we call the conus arteriosum or infundibulum. At the top of the infundibulum, you are going to find the opening of the pulmonary trunk with three semilunar valves. And here you are going to look at to the trabecula, the ridge, the bridge, and the papillary muscle. Only the ridge are visible here. The apex belong to the left ventricle, and here you are going to look at to interventricular septum, superiorly it is fibrous, and inferiorly it is muscular. Again here, inner layer of the left ventricle, the thick of the wall of the left ventricle is 3 times thicker than the right, and here is the inflow, here is the outflow. The outflow of the left ventricle we call the vestibule. We call vestibule of the aorta. Here is the left atrioventricular foramen, and inside of the left atrium, I am able to show you the opening of the pulmonary vein. Why we show by the red color? Because oxygenated blood. And you know the left atrium is going to form for you the posterior surface of the heart. It is going to form the base of the heart. And here you are going to look at the pulmonary trunk, divide to the left and the right pulmonary. Here is the ascending aorta, arc of the aorta, the brachiocephalic trunk, left common carotid, left subclavian. And here the vena cava superior is going to form by joining of the left brachiocephalic and the right brachiocephalic. Look at to the right pulmonary artery here, right pulmonary artery. It is passing posterior to the ascending aorta and vena cava superior. And what's the name of this opening? Azygos vein. So everything I explained for you here, except about the coronary. Here you are going to find the right coronary, the left coronary. In left coronary, I'm able to show you the anterior interventricular branch, the circumflex branch. The circumflex branch is going posteriorly. Here is the left margin and anterior interventricular branch. Here I'm able to show you diagonal branch. And about the right coronary, you are going to find the right marginal and here posterior interventricular branch. About the vein here, posterior the medial cardiac vein, it is going here, and here we have the lesser cardiac vein. Here, what's the name of this vein? Greater cardiac vein. And the left atrium, the left auricle also is visible here. Do you have any question here? No. Okay. And about the other? Give me this. Yes. No, this one. Ribs. And this one, and the trachea. About the trachea, look at here. The trachea, here is the carina trachea, the right pulmonary, the left pulmonary, and trachea is anterior to the esophagus. Now about the rib, it is a typical rib, posterior end, anterior end. You know, in posterior end, I'm able to show you the head, neck, and the tubercle. Between the tubercle and the angle, when you are coming from the first one to the 7, it is going, far from each other. Here is superior border, inferior border, external surface, internal surface. In internal surface, inferiorly, you are going to find the sulcus that we call the costal groove. Now, you tell to me, this belong to the left side or this belong to the right side? Left. So all of the item, all of the landmark are going to help to you. If I never notice to the costal groove, it is possible I think that this belong to the right side. But when I am going to speak about the costal groove, we know the costal groove is near the inferior, so it belongs to the left side. Left side. It is the first rib. It is the first rib. Look at here, the posterior, anterior. About the first rib, you should remember that the head, neck, and the tubercle, and the first rib has more curve compared to the other. And the angle is exactly on the tubercle.
Scalene tubercle.
Yes, scalene tubercle. Now about this, you should remember that here is not exactly noted. We can find, but here is the scalene tubercle, okay? Here is the scalene tubercle, and if we notice it is scalene tubercle, here is the posterior sulcus anterior. In anterior sulcus, which structure is present? Vein, subclavian vein, and posteriorly subclavian artery. Give me the second one. No, that one. And the 11. Yes, that's it. It is the second rib. Look at here, head, neck, and the tubercle. About the first rib, on the head you have one articular facet, but about the second you can find two articular facets and a crest that separate these two from each other. And look at to the, they are the same, not the same, but look at to the length. They are different. It is 2 times taller and longer than the first one. Here is the medial and the lateral, and here is the posterior end, anterior end. What about here? Look at it here. You have the external and internal. They are different. And something else? No. And this is the 12. No curve, no tubercle. The head and tubercle is not visible. Of course, here you broke. Okay. No. It's not matter. It's not matter. No. What's the name? No, don't like this. Hey, we keep this for your child. Okay, I explained this for you.
The intercostal muscles, the left
Yes,
extra.
but one thing that I want to explain here, lung. Which lung this is left or right? Left. This help to you. Okay, and another thing, this deep
Oblique
tissue, oblique. What about the right? How many?
3 lobes.
3 lobes.
Two
The
fissures.
fissure, horizontal and the oblique, superior, middle, and the inferior. Okay, I think everything I explained for you. Be careful. Read by yourself. If you have any question, I am here to answer your question.